think within the PPI category, physician preference items, from a contracting perspective, there's always a multitude of challenges just because the physician interests and the clinician interests sometimes are different from the supply chain goals. So the problem really there was, how do we align ourselves with the physicians so that the value that we see from a particular product is fully seen from the patient experience, physician experience, as well as from a cost management perspective. So it was really aligning those interests with the physicians and making sure that we had transparent and relevant information for them to make those types of clinical decisions. We implemented a physician phone application, which can also be used on a desktop, that showed our different pricing structures with the contracts we negotiated with our vendors, so that the physician could assess not only the type of technology for that particular patient, but also cost, so that we're really attacking those utilization savings. So we're utilizing the right product for the right patient. We implemented this program initially in January of 2015, so we have a full year, calendar year's worth of data. And at the medical center, our main facility, which is academic, we saved approximately 23%, over $1 million in our first year, and those are actual savings at this point because we were able to go back and track those. And CRM is a large spend category for any institution that's doing those procedures. So to drive down 23% cost reduction in one of our main spend areas was a big achievement for us. In addition to the kind of economic savings or the dollar savings, some of the other results of the initiative that were frankly kind of unexpected were that physicians were taking more time in their selection of a particular implant for a product. So some of the physician feedback that we got was that they were being more thoughtful, and they felt like that was actually translating into better patient care, because rather than being governed just by kind of their own habits or their relationships with a particular vendor that they'd used for a long time, they were actually assessing the value of the technology and really making a more reasoned thought process towards that. The other feedback that we got from the physicians is that they felt like in the past their contacts with supply chain were kind of limited, whereas during this initiative we became very much so in sync. So we were seeing scorecards constantly. We were looking at the same data and information. In the past, they had been relying upon sometimes the sales rep in order to know what something cost, which really wasn't the type of service that supply chain wanted to provide to the physicians. So we definitely strengthened that alignment with that physician group as part of the project.